Hey guys, Dr. Vince Lands here. I'm one of the orthopedic traumatologists here at North Oaks Hospital in Hammond, Louisiana. And today I'm here to talk to you a little bit about hip pain. So if you have any questions, please drop them in the comment line and I'll be happy to answer them for you.
So Dr. Lands, our first question, how do I know if I'm experiencing lower back pain or hip pain?
Okay, that's honestly a very good question. Typically when I talk with all of my patients, I try to keep hip pain quite simple. Usually I describe it in one of three different locations. I describe it being either anterior base, it's coming from the side, or it's more posterior base. Typically, if you're talking about anterior base hip pain, it's usually either within the hip joint itself, or it's just outside and more the soft tissues. If we're talking about more laterally based pain, it's usually coming from more the outside portion of your hip. And if we're describing more of a posterior based pain, usually it's more so coming either from the back of the joint here called the SI joint, or it's more likely coming from your lower back. And I think a good history as well as physical kind of helps us dictate where the exact pain location is coming from.
Thank you. So when should I see a doctor for my hip pain? At what point?
Well, I think you should always see a doctor, one, if the pain is causing you discomfort, if it's typically limiting your daily activities of pleasure, and if essentially it's just bothersome and you want to know. I mean, I'll be usually with this type of pain, usually it's always good at least to give you a sigh of relief that at least you rule out something that's not necessarily terrible.
So what are my options for non-surgical treatment? What are my non-surgical treatment options?
Well, I think it's dependent on the exact cause of your hip pain. So if we're talking about more anterior based pain, and usually patients, they come in and they describe it as being more groin pain. It bothers them more so as they walk. It limits their ability to stand for long periods of time. Usually they're more so talking about pain within the joint. A number of different causes of joint pain anteriorly. Now, more common things, if you're talking more of a younger patient, now we're talking more so, it can be something associated with more of the hip socket, okay? Sometimes the hip itself can cause discomfort that way. If we're talking more of an older patient, now we're more so talking about arthritis. And usually what we'll do, we'll always start off conservative. Typically we'll give them oral anti-inflammatories, and there are a number of different medications that you can use. But I think one of the key things in order to determine whether pain is actually coming from your hip is what we call a fluoroscopic hip injection. Basically what that means is that you give an injection within the hip joint. Now, some surgeons do this themselves, or usually what I do, I'd actually get the radiologist, and they would inject the hip. And they would inject essentially lidocaine, which is a numbing medication, as well as a steroid. Now this injection is both diagnostic as well as therapeutic. This helps to, if your pain is relieved after that injection, then I know exactly it's coming from the hip joint. If we're talking about more of a lateral based pain, more likely it's coming from more of a bursitis, okay? Usually patients complain of pain, it bothers them right on the outside. As they lie on the bed, they're sleeping at night, it bothers them. Sometimes the pain goes down the lateral aspect of their leg. If the pain doesn't go down the outside of the knee, it's more likely what we call the IT band syndrome. There is a band of tissue that attaches to the top of your hip, and it goes down to the outer part of your knee. And typically, if I were to press the outside portion of the leg, and if that bothers them, then usually what we can do, we can give them a number of different stretches. We can recommend those oral anti-inflammatories, and sometimes, if needed, I can give an injection right over the outer portion of the hip.
What about cortisone injections? How often can you receive those, and what do those do?
Well, a cortisone injection is basically given to decrease inflammation. Essentially, pain is generated by that, right? So, cortisone injections typically are given every 3 months.
So, if I'm at the point where I need surgery, what are my surgical treatment options?
I think it depends more so on the cause of the pain. Again, if we're thinking more of a anterior based pain, we're saying that this is due to arthritis. Once we've exhausted all those conservative treatments, those injections, we've tried physical therapy, we've tried oral anti-inflammatories, then usually what we can do what we call a hip replacement.
What are the types of hip replacements?
So hip replacement basically is essentially you're trying to remove the portion of the hip that's actually causing you pain. What we do typically, we clean out the outer portion of the hip socket here, and we place a metal shell within this portion. We then place a plastic cup to give additional support. And then for the hip portion side, usually what we do, we shell out the hip itself and then place a metal implant so that now we've removed the entire arthritic surface, so that now you're having a nice smooth hip. The different types of hip replacements that you can do, and I think it's all in regards to the surgeon. There's an anterior approach, there's a lateral base approach, and then there's a posterior base approach.
So what are the difference between those two, or three?
Well, generally with an anterior base approach, you're going through a muscle plane. You're not really cutting through the muscle, just going through the plane of it. And so typically the recovery is quicker for the first 6 weeks or so. Usually most patients are able to get out of the hospital quicker, and the recovery is a lot easier. It's not to say that the other approaches are bad, it's just a difference. Usually when you go from more of a lateral base approach, usually you're cutting through muscle. The recovery is a little bit longer, only because that muscle has to heal. And the same goes for posterior.
What goes into the recovery process after you have an anterior posterior hip replacement?
Well, generally what happens is once the hip replacement's done, most patients are able to get up. However, just from the surgery itself, usually they'll have some type of pain, and so I think one, we're trying to manage their pain, and two, it's more so the rehab process. And so these patients, they're involved in physical therapy, and this is to get their hip back strong to the point to where they were before. And I think getting up early, starting with therapy at an early date, allows them to continue to progress and get stronger day by day.
Awesome. Is there anything else that you would like to add?
Well, I think, guys, if you're having hip pain, whether it's coming from the front, whether it's coming from the side, or whether it's coming from the back, if you're having this discomfort, then definitely get it evaluated by a surgeon. Whomever the person may be, and if it's me, I'll be more than happy to take care of it. So if you're having any hip pain or joint pain, don't wait to make an appointment. You can always call 985-230-BONE to schedule an appointment with me, or you can be happy to schedule with any other providers as well.